We are going to understand some structures. The superior sagittal sinus. If we want to activate the superior sagittal sinus, then we have to activate 1, 2, 3, 4, 5, and 6 structures. Okay. So number one, metopic suture and bregma. So what is that? Look at this skull. This is the frontal bone, and this is the parietal bone. We know the parietal bone is one on the right side, one on the left side. But the frontal bone is only single, only one. As per the osteopathy, we have considered the frontal bone also in two parts, but we will count one only. But we will be considering the frontal bone is having two parts because in between the frontal bone, we are having one suture. The name of this suture is metopic suture. Which is separating the right side of the frontal bone with the left side of the frontal. So now, on the back side of the frontal bone, this is the parietal bone, right and the left. So this is a junction where the frontal bone meeting with the parietal bone. This junction is called bregma. So look at here. The frontal bone starts from here. We can see this is the frontal bone. But the frontal bone is still continue near about 3 finger. If you feel here, you will find the junction. You will find the junction. Okay, one is ending, another one is starting. So near about the frontal bone is this much. Okay, this entire. When small baby, we can see infant, small baby maybe within few months, we can see very soft part. Here, that soft part is called bregma or talu sthan. It's a very soft. Okay, here. Then we are telling, okay, apply some oil, apply something here so that it can close very fast. That is talu sthan or the bregma. Okay. So metopic suture till the bregma. The junction is bregma. Then on the back side, we are having sagittal suture. So the sagittal suture is the suture who is separating the right parietal bone with the left parietal bone. So we have seen three structures. One is the metopic suture. One is the bregma. Then in between we are having, this is the structure. The name of the structure is sagittal suture. Please remember this structure because I will tell you the technique of metopic suture, the technique of bregma, the technique of this sagittal suture, and with the help of this technique, we will be working on superior sagittal sinus. Then we are going on the back side. We can see this is the occipital bone. So the right parietal bone, left parietal bone. In between, we are having suture, sagittal suture, and this is the occipital bone. And the junction between This is the lambda. The name of this structure is lambda. What is lambda? Lambda is the place where the parietal bone meeting with the occipital bone. You have seen many people are keeping sikha or choti here. Sikha or choti. We are keeping sikha choti on the lambda because lambda is also soft, like being the small baby or we see the infant. We can see the soft part here. We can see soft part there also. That is lambda. So bregma and lambda. Here, lambda is the junction, and on the both side of the lambda, we can see this suture here, this suture here. The suture is connecting the parietal bone with the occipital bone. So the name of this suture is lambdoid suture. Lambdoid suture. Okay, and the middle structure is lambda. The suture around is the lambdoid suture. So we have seen the metapic suture in between the frontal bone, bregma. We have seen sagittal suture, lambda. We have seen the occipital bone, that is squamma. And the last structure, EOP here, external occipital protuberance. You can see your hairline, posterior hairline. Just see where your hair are ending. Just glide your finger and see the end point of hairline and keep the forefinger there like this. So the lowermost finger on the hairline. Now, below the uppermost finger, you will feel one protruded structure, that is protuberance. हम जब चार उंगली ऐसे रखते हैं तो सबसे ऊपर की उंगली के अंदर एक गठान जैसी दिखती है, उसी का नाम है EOP, external occipital protuberance. Keep the finger here. Now, just below the uppermost finger, we will find one elevation, one protrusion. कुछ उठा हुआ दिख रहा है गांठ जैसी? नहीं दिख रही तो 1-2 मिलीमीटर इधर उधर जाइए. Just go 1 few millimeter here and there. You will find one elevated part that is called EOP, external occipital protuberance. We'll show you in image. Let's see this image. We can see here. So the external occipital protuberance we will find here, one elevated part. Done. So what we have discussed today, on this basis, I will post the quiz. Maybe tonight, maybe tomorrow, depends. So you see the video and go through with the video and remember all the landmarks starting from metopic suture, bregma, sagittal suture, lambda, occipital squamma, and the EOP. These structure we will stimulate for superior sagittal sinus. Okay. So now the same structure we can see here if you look at this skull. If you see in this skull, the metopic suture will be in the center here. Then we can see this is the junction of the frontal bone with the parietal bone. This is the bregma. This is the sagittal suture. Then we go on the back side. So this is the ending of the parietal bone, occipital bone starting. So this is the lambda and lambdate suture. This is the part of the occipital schema. And from here, if we go forefinger up, we can feel the elevation that is external occipital protuberance. So enough for today. Now we'll see you tomorrow. Thank you so much. Let's close down.